Diabetes does not automatically rule out dental implant treatment. The important questions are how well the condition is controlled, whether other risk factors are present, and how the treatment will be planned and maintained. Persistently elevated blood glucose may affect healing and can be associated with inflammation around implants. Risk is also influenced by gum health, smoking, medication, bone condition, the extent of surgery, and the patient's ability to maintain oral hygiene. Before treatment, the dental team needs an accurate medical history, current medicines, and relevant information about diabetic control. Communication with the treating physician may be appropriate, especially when control is uncertain or other medical conditions are present. There is no single blood test number that determines suitability for every patient. The result must be interpreted alongside the patient's wider health and the complexity of the planned surgery. When diabetes is appropriately managed, many patients may still be considered for implant treatment. The plan may involve controlling periodontal inflammation, improving plaque control, modifying the surgical approach, and allowing appropriate healing time. After surgery, daily cleaning and personalized professional reviews are particularly important. Increasing pain, swelling, discharge, bleeding, or movement should be reported promptly. The correct answer is therefore not a simple yes or no. Diabetes must be evaluated as part of an individual clinical and medical risk assessment. For an individual assessment, send your dental photos, X-ray, and relevant medical information to Renova Clinic in Istanbul. Never change diabetes medication without instructions from the prescribing medical professional.